Chapter 28, Infection Prevention and Control. We as nurses are essential to help prevent infection and its control by creating safe healthcare environments for our patients and their families. For an infection, some pathogen, it can be a bacteria, it can be a fungus, it can be a virus, invades the bodily tissues and grows within the host or the individual. For us, as scientists, colonization is when we have growth of microorganisms within a host, but there is no damage or invasion to the tissue. The chain of infection is one that needs to be broken in order to prevent the spread of infection. An infectious agent can be a bacteria, a virus, a fungus, or a protozoa. We know that we have normal flora that live on our skin. These help protect us as individuals. The reservoir is the place where the infectious agent survives and multiplies and then waits to be transferred. It needs specific food. Some need oxygen, meaning that they're aerobic, they require oxygen. Anaerobic, that means they do not need any oxygen to survive. They need water or moisture. They need a specific temperature. The pH, most of the infectious agents prefer a pH with a range of 5.0 to 7.0. And oftentimes, these infectious agents thrive in dark environments. A portal of exit, this can be blood, skin, mucous membranes, respiratory tract, can be the urinary tract, gastrointestinal tract, it can be the placenta, meaning it's transplacental between mother and child. We know that modes of transmission depend on the disease process. The major route of transmission, especially when you think about the coronavirus, is the lack of appropriate hand hygiene. Oftentimes, we as individuals carry a virus or an infection to someone else because we don't wash our hands appropriately. A portal of entry, these mimic the portals of exit. They oftentimes are the same routes. A susceptible host, so in order for that infectious agent to thrive in another human being or another host, the host has to have some sort of degree or lack of degree to resisting those specific pathogens. The chain of infection starts with the infectious agent, a bacteria, a fungus, a virus, a protozoa. They have a specific home or reservoir where they live. They need specific air, water, pH, temperature, oxygen, and food. Then they find a portal of exit. So they get out of their home, their reservoir, and now they are out floating around. Somehow they are transmitted. That's your mode of transmission. Is it through a cough or sneeze? Is it through hand contact, contact of other substances? Portal of entry often mimics the portal of exit. Respiratory, genitourinary. A susceptible host. So in order for the infectious agent to survive, it has to have a host that is welcoming. So if you already have or are compromised, your infectious system is compromised, you may be the perfect host for the next infectious agent. A patient is admitted to a medical unit for a home-acquired pressure ulcer. The patient has Alzheimer's disease and has been incontinent of urine. The nurse inserts a Foley catheter. You will identify a link in the infection chain as the answer is C. The Foley catheter bag could be both a portal of exit and a portal of entry. When we talk about the infectious process, we need to think about the way that the infection may be transmitted. It can be contact, direct contact, person to person. It can be indirect contact. Maybe it might be tabletop or some other inanimate object that has the microbes on it. It can be a droplet when a person coughs or sneezes. It can be airborne that floats in the air. It can be some type of an item, like a sharp item that may have a contaminant on it. Think about HIV or hepatitis. Or it could be a vector, something along the lines of a mosquito or a louse. When we think about the infectious process, we also know that our body has its own defense mechanism. On our skin, in our gastrointestinal tract, in our perineal area, there is normal flora that helps protect our system. We also have specific bodily defensive systems, and we also have the system of inflammation. When we think about inflammation, it is no more than a cellular response of our bodies to some sort of injury or infection. It is a protective reaction. It brings blood products, and nutrients to the area of injury. During the process of inflammation, it helps to neutralize and eliminate the pathogens or any dead necrotic tissue. And it also helps the body to repair its cells. Inflammation can become systemic. Systemic would be bodily system wide. Signs and symptoms that you may see in an individual could include a fever, an increased white blood cell count, could be a general feeling of malaise, could be nausea and vomiting, could be lymph node enlargement. Acute inflammation happens immediately to any type of injury of the cells. There is a vasodilation that occurs. More blood is delivered to the area of injury. The increase in the blood flow causes the redness and warmth at the site. During the cellular response, white blood cells arrive at that site. These white blood cells go through the vessels and into the tissues. Phagocytosis, or like as I like to remember them, Pac-Man, the video game Pac-Man, they are involved in the destruction and the absorption of any bacteria. We know that in an adult, our typical white blood cell count is between 5,000 to 10,000. But depending on the amount of inflammation in our system, it can rise to 15 to 20,000. Healthcare-associated infections. These often are due to the result of some health service. These can occur due to some type of an invasive procedure, an antibiotic administration, maybe the presence of multi-drug resistant organisms, or breaks in the infection prevention and control. Healthcare-associated infections are extremely costly to the healthcare system. The patients that get healthcare-associated infections often have other underlying illnesses. They could be older adults or poorly nourished. Mrs. Eldridge, she's a 63-year-old woman. She underwent a total hip replacement. Kathy Jackson is a student nurse that is caring for Mrs. Eldridge on her home health clinical rotation. 2 weeks after surgery, Mrs. Eldridge complains to Kathy that she has increased pain in her hip and she has a low-grade fever. Kathy observes the incision and notes that it is red, swollen, and warm. What do the fever and the warm, swollen incision likely indicate? Is an infection at a wound site likely to be systemic or localized? There are factors that influence prevention and control of infection. One is age. We know that the very young, as well as the very old, are more likely susceptible to getting an infection versus the middle-aged adult. We also know that men and women differ in their immune responses. While estrogen promotes immune responses, androgens suppress immune responses during infection and after vaccination. They can also increase the risk for autoimmune disorders. Patient's nutritional status does influence the patient's infection prevention and control. We all need a certain amount of protein and other nutrients like carbohydrates and fats to help our bodies fight infection and do adequate wound healing. Stress plays a role in infection prevention as well. We know that when we're in that alarm state, our body will use its energy stores. During this time frame, our serum glucose levels will increase. This will decrease anti-inflammatory responses because we will release cortisone. If our stress would continue, elevated cortisone will decrease resistance to any type of infection. When discussing the disease process in infection prevention, any patient that has an underlying illness or disease of their immune system is at greater risk for getting an infection. Think about patients with leukemia or cancer or AIDS. These individuals may not have enough white blood cells to fight off an infection. Mrs. Eldridge's wound was infected. She was admitted and she received IV antibiotics and wound irrigation. She was discharged on day 4. At present, her wound remains open, but it is healing with new granulation tissue that is healthy. What is granulation tissue? Let's now use our ADPI or our nursing process to look at the infectious process. So we begin with the assessment. That is our A of ADPI. When you're thinking about your patient, you're going to ask them specific questions. You want to know about their past experiences. If they had any specific diseases in the past, what do they know related to infection? Do they know about adequate hand washing? As a nurse, we will ask our patient about risk factors. So we need to ask them about potential vaccinations that they have had. We're asking them about any diseases or illnesses that they have had, or those they might have had treatment for. We need to know about any recent diagnostic testing that they would have had. We want to know what they eat during a normal day. With clinical appearance, we're actually looking at the wound site. We're looking at the signs and symptoms. So we're going to determine whether or not our patient has an infection. Localized, or I think of localized infections as like a hangnail. Okay, they're common in areas of skin or mucous membrane breakdown. So if we're looking for a localized infection, we're going to look for redness, which is, and we're going to look for warmth and swelling. So edema, erythema, there might be pain, there may be some drainage, yellow, green, brown, depending on the pathogen. That will be a localized infection. A systemic or bodily infection causes more generalized symptoms. These are symptoms for systemic infection of fever, malaise, maybe a nausea and vomiting. Lymph nodes are going to be maybe hard and sore. Patient's going to feel tired. When you're thinking about the defensive mechanisms, we need to consider the patient's medications. We know as nurses that some medications will compromise a patient's immunity. If the immunity is compromised, that means the risk of infection increases. We also need to know about our patient and if they've been exposed to any communicable diseases through recent travel. So you're going to ask them if they potentially went anywhere in the past couple weeks to a month. We're also going to look at their lab values. So I told you for a white blood cell count, it should be between 5 to 10,000 millimeters cubed. Anything over that is going to indicate to a nurse that the patient may have an infection. You are now caring for a patient who underwent surgery 48 hours ago. On the physical assessment, you notice that the wound looks red and swollen. The patient's white blood cells are elevated. You should The answer is B. When your patient shows signs of an infection, the nurse should notify the primary health care provider immediately because we want to ensure that our patient gets immediate treatment. This could potentially ward off a systemic infection. When we're working our way through ADPI, this is your D, the nursing diagnosis. So during the time of the nursing diagnosis, we are taking all of the assessment data and patient information that we as the nurse have gathered. We're going to analyze that data. We're going to look for cues or clues so we can assess the findings, and we will look for a pattern for our patient. These are definitive diagnoses for patients that have an infection. You have a risk for infection, means that the potential is there, but there are no signs and symptoms. We talked about needing appropriate nutritional status, so protein for wound repair. We know that if the mucous membranes are broken down, that is chance for the patient to get an infection. If your patient has an infection, they may become isolated. That's why social isolation comes in. And anytime your patient has potential for skin breakdown, we can always think about impaired tissue integrity, meaning that the tissue is easily broken, and that's a good way to induce an infectious agent into a susceptible host. In the planning phase, the nurse and the patient work together to determine goals or outcomes for the patient. When you're thinking about infection, as a nurse, we want to prevent our patient from getting greater exposure. We want to make sure that we're able to control the infection and it doesn't become any worse. Maybe we need to maintain the patient's resistance to infection. We always want to make sure that our patient has an understanding of infection prevention. As nurses, we learn to set priorities. So when we're setting priorities for a patient, we're thinking, is it important for the patient to eat and have adequate protein versus being able to visit with their family? We need to learn to help our patients set priorities. We as nurses have priorities that we follow. When we're using the nursing process, it's always collaboration and teamwork. There is no nurse that does not function individually without using members of the team to provide adequate patient care. Mrs. Eldridge continues recovering at home. When she visits Mrs. Eldridge, Kathy teaches her about infection prevention and control practices. So you need to be thinking about patient education and how you would ensure that your patient understands about infection prevention and control. What are some things you would help your patient learn? What are some teaching strategies to help your patient achieve this outcome or this goal that we have for our patient? Implementation. This is the I in ADPI. This is when we actually do the steps of our plan. So when we're looking at health promotion, as a nurse, we're using our own clinical judgment and our critical thinking to prevent an infection from spreading or developing. We know that our patient needs adequate diet to help their immune system function. They need a variety of foods. They need a specific amount of protein, carbohydrates, and fats. We know that an individual's hygiene will reduce the amount of microorganisms on their skin, and it will also help the patient maintain the mucous membrane integrity. The Centers for Disease Control advises that individuals begin immunization practices at a very young age. With immunizations, think about tetanus, diphtheria, MMR, shingles, pneumonia vaccines. For our patients to maintain their health and wellness, they need to make sure that they're getting adequate physical exercise to promote strength, will increase their lung capacity, their energy, their circulation. They also need an adequate amount of rest because it will help them to heal if they do have an infection. Acute care is care that happens right now. Think of the hospital situation or going to the doctor because you have a fever. So we first think about treatment to help eliminate the infectious organism, and then we want to make sure that we're helping to support our patient. So we want to make sure that we're providing them with information, education, medication, everything your patient needs. Medical asepsis. So asepsis means the absence of a disease-producing pathogen or microorganism. It also, aseptic technique refers to the way that we as nurses perform our procedures to decrease the risk of infection for our patients. Using medical asepsis will break that chain of infection. Through appropriate cleaning, disinfecting, and or sterilization, this will help to reduce or eliminate microorganisms for our patients. Cleaning is something that we do before we disinfect and sterilize. When an object comes into contact with an infection or an infectious agent, it is considered as being contaminated. Disinfection is a process that eliminates many or most of the microorganisms. It will not remove spores. Sterilization will eliminate or destroy all microorganisms, including spores. As nurses, we aim to help protect our patients who could potentially be a susceptible host for an infection. We need to ensure that the patient's resistance is improved because we're going to help protect the patient's normal body defenses. We eliminate reservoirs for infection. We will control the entry and exit ports, and we avoid any type of actions that can transmit any microorganisms to a new site. When we talk about controlling the portals of exit or entry, this brings in the conversation of standard precautions. Standard precautions are the way that we treat all patients, no matter what the situation. Standard precautions for a nurse today is having a mask on and making sure that you have gloves on before you do any patient care. Standard precautions According to the Centers for Disease Control and Prevention, these apply to any blood products, any body fluids, bodily secretions, excretions, except for sweat, any tear in skin, and any mucous membranes. So as nurses, we're always going to perform hand hygiene before we work with our patients, in between working with different patients, after we come in contact with any potential contaminants, and exactly after we remove our exam gloves. We want to make sure that when our hands are visibly soiled, they are washed with soap and water. When they are not visibly soiled, as a nurse, we can use alcohol-based hand rubs. We just want them to be 60% alcohol. Standard precautions, as I said, are used for every patient. They're used in all healthcare settings, no matter the risk or presumed status of infection for our patients. We use them for preventing infection transmission, and this applies to any blood or bodily fluids, non-intact skin, mucous membranes, or any surfaces that are potentially contaminated. For us, this would be barrier precautions. As a nurse, we know we have to wear appropriate personal protective equipment, or PPE. In a hospital today, that may be an isolation gown, exam gloves, a mask, eye protection, or other means of protective equipment. Transmission-based precautions, these are your airborne, droplet, contact, and protective environment. Airborne precautions, these are for droplets that are less than 5 micromillimeters. Droplet precautions are larger than 5. We also have contact, and then we have protective. So airborne precautions, your patient should be in a private room. They should have what's called negative pressure airflow. So negative pressure airflow means that that room is not ventilated throughout the rest of the hospital. It has its own ventilation system. If the patient has to leave the room, they need to have a mask on. The patient's door should be closed. Anyone that enters that room should have a respiratory device or an N95 mask. For droplet precautions, your patient should be in a private room, or a patient that has the same disease process. Their door does not have to be closed because the droplets are larger than the airborne dropules. But if they leave, they still need to have a mask on. Contact precautions, these individuals are in a private room. As nursing personnel, we would wear gowns and gloves. Your protective environment, these are patients that are stem cell recipients, transplant recipients. These individuals need a private room. They need positive airflow. Anybody that enters that room needs to wear a gown, a mask, and gloves, because we are protecting the patient from us because their immune system is going to be compromised. The gown is used to help protect the medical personnel's clothing. The mask helps protect the nurse from inhaling any of the droplet particles that are in the air. Eye protection is to maintain eye safety from any splashing, and gloves are used in direct patient care to help prevent the transmission of any disease or pathogen. This is an example of a N95 mask. Oftentimes, an institution will have an infection control person, and that's oftentimes a registered nurse. This individual is responsible to collect any and all information related to infection. They will evaluate any of the medical products that are being used, the procedures that are being accomplished. They will review policies and procedures and revise or develop new policies and procedures. They will consult on infectious assessment and disease processes and strategies to promote the decrease of infection. They provide education to the staff. They are in charge of ensuring that changes are made. So if the Regulatory Commission for Hospitals, which would be the Joint Commission, changes something, the infectious control individual would ensure that that gets changed throughout the hospital system. They also apply any epidemiological principles. So think of activities that are directed at improving patient outcomes. They look at the antimicrobials that are being used. They may participate in research, and they will monitor any of the antibiotic resistant organisms that happen to be in the healthcare institution. The World Health Organization has 5 moments for hand hygiene. First is before we touch a patient. Then before we do any clean or aseptic procedure. After we have been around or been involved with any bodily fluids. After we touch a patient, or after we touch any of the patient's surroundings or any of their belongings. As nurses, it is our job to educate our patients on infection control and prevention. We teach them as part of the ongoing education while they're within the hospital system, because when they go home, they need to understand how to promote their own self-care. So we want to make sure that they understand how to adequately take care of themselves, wash their hands appropriately, cook their food to adequate temperatures, cleaning their house, using a Clorox or a vinegar solution to clean up different spills. That is part of our nursing profession, is to educate our patients. There is always the risk of exposure for any medical personnel. If we are inadvertently exposed, we will make out an incident report and make sure that our nurse manager knows. Things like accidental needle sticks aren't as common as they used to be because they now all have safety devices on them. If we're potentially exposed to any blood or other infectious materials or any specific type diseases, we can have blood drawn from our patient to check their system depending on the state that we live in. It is something that is required that the employee is given the patient's testing results if an exposure does occur. This is not a violation of the HIPAA Act of 1996. Here are your 5 moments for hand hygiene: before touching, before a procedure, after any bodily fluids, after touching, and after being around any of the patient's surroundings. Surgical asepsis, or surgical techniques, is the removal of all microorganisms, including spores, that could be harmful to our patient. We want to make sure that our patient has an understanding of what is going to happen during a sterile procedure, and we want to make sure that we thoroughly explain to the patient the reasons for them not moving or putting their hands in the sterile field. When we perform sterile procedures, we want to make sure that we have sterile gloves on. We know how to put our gloves on. We want to make sure that we understand the principle of surgical asepsis, so that if anything is sterile, only sterile can touch sterile. If anything that is not sterile or anything that is sterile touches anything that is not sterile, the sterile item is now contaminated. If for some reason the area of sterility is questionable, that area is considered as contaminated. We want to make sure that we take great care of our patients, and we as nurses know we need to always eye on the side of caution. So if anyone, the saying for surgery nurses is, when in doubt, throw it out. So you're better off to eye on the side of caution if you have doubts, and just start the procedure fresh and anew. When opening sterile items or adding items to a sterile field, one needs to make sure that you can open the package without contaminating the product inside the package. Sterile supplies are kept in a clean and enclosed storage cabinet, and they are always separated from other non-sterile supplies. When you're opening a sterile package, you want to make sure that you pull the wrapper so that way your hand goes before the wrapper on the package. You do not want to place your hand over top of the sterile item for fear that you might have some of your skin cells that would fall into the sterile field or the sterile packaging. After we do the implementation in our nursing process, now we go to the evaluation. Remember, the E is the evaluation part of ADPI. When we're doing our evaluation, we're determining whether we have been successful in preventing infection and whether or not we've been able to achieve our outcome to help reduce the infection or prevent the infection that we identified in our patient's care plan. Patient outcomes are patient goals. So we are determining whether or not the goal that we have set for our patient has been met. Your patient has expectations. You need to make sure that our nursing practice and our nursing standards are up to the patient's expectations. So we need to ensure that our patient actually is successful in meeting the goals that we set forth for them. An example for decreasing the chances of infection would maybe be not having a fever or not having any drainage from the wound. If for some reason we aren't able to help our patients with their goal, then we need to revisit our ADPI process, and we need to go back to the assessment stage and see if potentially we have missed any of the patient information. Did we have adequate lab values? Did we maybe miss some steps when we were planning and when we're implementing our plan? Did we maybe jump too quickly and miss some steps? As a nurse, we always use standard precautions. Every patient gets treated the same no matter what. We always wear exam gloves when we're going to take care of any patients or come in contact with any of the patient's belongings. If there is a chance that we could have anything get splashed on our person, we want to make sure that we're wearing a gown, we're wearing eye protection. We want to make sure that any equipment that we use on one patient is cleaned before it is used on the next patient. We also teach our patients about cough and sneeze etiquette, and we want to make sure that they're covering their nose, their mouth, that they're using a tissue, disposing of those when they're finished, and then washing their hands. This all has to do with infection control and prevention.